So let's talk about the topic that's very dear to me, and I've titled this "After Treatment" and going beyond that. And I think what I would like first to ask is show of hands, who here considers themselves a survivor? Okay. So there's quite a bit of you. When I asked this question at the Young Survival Coalition in Austin recently, the minority rose their hands. And I think it's important, and one of the things I will tell you today is I think that the term survivorship, we've lost what it means. And at the end of today, everyone in this room should raise their hands proudly and reclaim that term of survivor. So this is the first point that I always like to make for when I give this talk for professionals, but also for folks here. Never, ever use cancer to define you, all right? And I tell my colleagues this as well. When you're looking into your clinic, that is a woman with breast cancer that you're seeing. That's not that's not breast cancer in that room, all right? You are never your disease. So cancer is a noun. Never let any of us, never accept use of cancer as an adjective. You are not a breast cancer survivor. You're not an ovarian cancer survivor. You are a woman, you are a man with or loving or supporting someone with a disease. So again, never let it define you, and certainly never let it describe you. And this is the term that I think I also would like you to embrace. So this is the National Coalition for Cancer Survivorship's definition of a cancer survivor. And I think we lost our way when the Institute of Medicine put out a mandate that folks treated for cancer the first time require direction, and they want to know what their future might look like. And so we started thinking of survivor in terms of those who are cured once and for all. That is not the definition. You are a cancer survivor from the point of diagnosis until whatever happens in life. You are a survivor. Your family are survivors. Those people taking care of you are survivors. It's this all-encompassing definition of what a cancer survivor is. And I want us all to remember that and re-embrace it, because it is pertinent. When I speak about the new normal, it is after your life has been changed. So most people take the diagnosis and there's just so much emotion in it and there's so much fear. So when I meet a person for the first time with ovarian cancer, endometrial cancer, or breast cancer, I look in those eyes of all of my patients and it's always the same look. What are you going to tell me? So what I tell them is, if I think it's true, and 99% of the time I can say it, I tell folks, you are not dying. Right? And then they can breathe out. Because after that point of diagnosis, you start in this process of trying to redefine what your life is like. What is my new normal? It doesn't start after that chemotherapy completes. I think it starts at the point you hear this term that is going to alter who you are and how you live and how you interact. So what is it about the new normal? It's a process. Oftentimes I'll hear folks who are going through radiation, and at Mass General, there's a cowbell that rings once you finish your treatment. And I think that's great. And I certainly celebrate with my patients after they're done with that final round of chemotherapy. But we all know that final bell and that final round doesn't mean you're done, right? It doesn't mean that all of a sudden you can pick up where you were and just resume it, because it's a process. You are changed, physically changed. There are things that treatment will do to your body: fatigue, weight gain, loss of energy, and then the sea leg effect, right? How do I exist like this now? So the new normal is a process where you allow yourself to question what just happened to me. And if you've relapsed, and if you're under treatment over and over, what is happening to me is a very legitimate question. It's also a redefinition of what your life is now, today, and it's not static. Just like we know, patients may get married in their 20s, they may get divorced in their 40s. Life is a process, and we're always redefining it. The same is true for all of us, and it's particularly acute after you're undergoing or have completed treatment where we're delivering poisons to your body. It is absolutely true. But the new normal is also an understanding that you are still here, right? That even after everything we've done to help save you, the removal of body parts that define femininity, that define womanhood, even after the chemotherapy that takes your hair, that I think also smooths wrinkles, by the way, but that's an aside. But, that takes your hair, that takes your energy, it's something that you have to define yourself from. And from that point forward, that redefinition happens all the time. But it's an understanding of you're stronger than you thought you were, because you took everything I could give you medically and you walked out that other side, and you continue to walk through that door, and you continue to come back. Celebrate that strength, but it's something you need to realize with time was actually a strength. So all of this encompasses one big thing. That new normal is an evolution. And it's going to be an evolution as you and I walk through life. What it is not, and I think this is some of the things I'm learning from my own patients, is the perception sometimes we leave them with. It is absolutely not instantaneous, right? So you're not going to just go through cancer and then all of a sudden figure it out, right? So there's no one point where that survivor, that term, there's no one point where it's ever going to fit perfectly. Women, men call themselves thrivers rather than survivor, right? Some people just reject the term. An argument, a very legitimate one, is folks who have a heart attack don't go around calling themselves survivors. They had a heart attack, right? So why do I need to embrace a term? I'll tell you why the term is important. Because if folks like Maria Bakaitis, folks like Sylvia, folks like me want to fundraise, do research to help make quality of life better, we need to define you in some way. And that term, that accepted term, is survivor. Okay? So you don't ever have to embrace that term, but understand that we realize that survivorship is an ongoing process, that this new normal is something that happens with time, and it's not something that is celebratory for everybody. Folks with a gynecologic cancer have a prognosis and a risk of recurrence that is far higher than most women with breast cancer. So when they're getting that final dose of chemotherapy for ovarian cancer, the next step is realizing once I take those tools away from you, there's a 90%, 80% chance that it's going to come back in 3 years. So imagine that, and then ask people to celebrate the fact that they don't have cancer. Okay? It's also not easy. If you've experienced frustration after you've been diagnosed and treated, if you experience that fear of what's coming next, and if you have anxiety about what's happened to you and what might happen in the future. That's the new normal. The question then becomes, how do I get on top of all of that? It used to be we talked about how long it would be to return to normal, but we never go back to where we were. Cancer transforms lives. This is a statement that Marissa Weiss made in 2010, and it's still true today. So, what are some of the issues in the new normalcy that I can speak on for you today? The first is fear of recurrence, which is a thing, all right? That's a real thing. We can talk about body image. We can talk in a very G-rated way about intimacy and sexuality. And we can talk about fertility and parenthood, healthy lifestyles, no matter if you are free of disease or you're living with metastatic disease. Healthy lifestyles is a thing that people want to talk about. And then we can talk about opportunities or loss of opportunities, and certainly financial risk. So fear of recurrence is that sense of worry that can sometimes be paralyzing about when it's going to come back. How am I going to know it's back? When is my next blood test? I don't want to get that blood test. All right? It's that fear, and it's real, and it happens in the first year after you're done with your treatments. That's when it's usually the most acute. Young women and men are the most at risk for it. If you're a parent, you're at risk for it. If you're living alone, you're at risk. And if you were diagnosed with stage 3 disease, that fear is much higher than someone who had ductal carcinoma in situ. All right? What you need to understand, as much as you might experience that fear, it is much greater for those people who have to look at you go through it. So it affects parents, and it affects spouses, and it affects kids, and in some studies, even more than it affects you. All right? Cancer is a social disease. Fear of recurrence is a social experience. But we can do something about it. And in the breast cancer literature, we now are learning that psychological counseling, therapy, can help people take control of the fear so it doesn't paralyze you. So this is a study called Conquer Fear. It was presented a couple of years ago. It included women and men with breast, colorectal cancers, and melanoma who, on a standardized questionnaire, had high fear of recurrence scores. So the intervention that they were given was Conquer Fear, which is here on the left, and it was compared to relaxation exercises. So Conquer Fear, it's really about what's something called cognitive behavioral therapy, sort of getting to a point where the uncertainty of life doesn't scare you. Choosing what you focus on consciously, and then adopting what you believe is a way to help screen you for a recurrence. So giving you control back. And what we saw is, compared to relaxation, you can absolutely reduce those fear of recurrence scores, and it can stay that way. You can have control that lasts up to 6 months and longer. So the point is, you don't need this, this specific regimen, but you need to look for help. If this is something in your life, you need not suffer, and you don't need medication. Okay? What about body image? And here we focus on breast cancer, because this is where a lot of the literature is. Everyone here knows treatments for breast cancer changes your body. whether or not you had a lumpectomy or mastectomy, whether you went through chemotherapy or not, there are changes in your body image. And that change is what you perceive. And the way I explain this to women in a way that they can hear it back in a way they process, your partner might look at you and say, you are more beautiful today than when I met you. And that sounds great. But the biggest critic, the biggest voice that tells you you're different is the one that's talking to you when you look in that mirror, right? So what we also know is that even among those women who had that reconstructive process, what you thought reconstruction was going to be, what it ends up being, very different things. So this is a very small study we did 6 years ago now. Of 126 women who went through a mastectomy and underwent reconstruction, only 63 of those women went to nipple areolar construction, and less than 15 did the nipple tattooing. And I think part of that was you have a thought of what your breasts are going to look like after you reconstruct, and then you realize it's not one surgery. Maybe it's 2, 3, 4. Maybe there's a complication and the things need to come out. 5, 6, 7 surgeries. And by the time a year is out and you're not done, a lot of them say, I can do without the tattoo. All right? But again, if you're struggling with your body image, realize that you are not alone. Most women, and this includes women treated for gynecologic cancers, most women experience those changes in how they see themselves. And that voice that tells you you are different now does get quieter with time. But just like with fear of recurrence, we are learning there are ways to help you recover from seeing yourself as different, and it's group therapy. Finding your people can help all of you look at yourselves in a positive way once more. All right, so this is another study, 194 women with breast cancer. It was a group therapy sessions versus standard of care, which meant nothing. All right, less concerns about body image for those women who went to these group sessions. Things like this are important. And there were lower levels of breast-related concerns as well. So finding that community, joining that community, can help you recover. What about sexual dysfunction? We know it happens, and we know it lasts. And then we know it's not something that we as oncologists do a great job with. So this is a Livestrong survey that queried predominantly younger patients diagnosed with cancer before the age of 40. Look at this. Sexual function and satisfaction was the third most common physical concern raised in that survey. And of that, less than half ever even got help for it. Why? It's because we didn't bring up the question. Oncologists will say, well, if it's important, you'll bring it up. And it's like, okay. If you don't bring it up, and this is what I tell my oncology colleagues, this has consequences well beyond the woman you are treating for your cancer. This can cause sadness and depression in over 40%. And it can affect relationships in over 60%. And it's also a reason that women and men might feel stigmatized by cancer. All right? So it's important that we address it, not only for you, but for your family. And it's important to know that sex is beyond any physical act, right? So sometimes our docs say, well, you know, Sex isn't that important after cancer. You should be lucky you're alive. Maybe an act might not be that important, but look at what sexual health is. All of this is important. And what's an issue for women specifically is that sexual dysfunction doesn't make sense. Sexual health doesn't make sense after cancer. So true or false, sexual health in men and women is impacted similarly after a cancer diagnosis. Seeing someone just say, So that's false. This is really male sexual health. Okay? And this, I explain this not, to be sort of glib, but the experience of intimacy for men is really powerfully achieved with penetration. Okay? It's not so for women, right? So I do use this because sexual health for women, it used to be like that computer where something whirs and it turns on and you can use your computer. Then after cancer, you turn something on and the thing's blank. And you're just saying, I don't know why it's not working. And there might even be a sense of, I know it should work and I don't even know how to talk about it because I never had to talk about this before, right? Well, this is female sexual health as I like to explain it. For women, the thing that woke you up sexually was a want of intimacy. It's a circular model. Intimacy drove your body to be stimulated. And then when that stimuli happens, you get aroused. And with that arousal comes desire. And then when desire is satisfied, you want it all over again. But unlike men, what's missing from the circle? Any kind of sexual act, right? Penetration, whatever, it's not in there. This is why I explain to husbands when I see couples in sexual health. If you just did the dishes, she would be satisfied. And then this whole circle might start. All right? Women don't need acts to be sexually satisfied because sexual satisfaction is more than physical. Your partners, just to realize that if they are looking for intercourse or an activity, whatever that might look like, it's not fair to them to think it's because it's just this basic act that all men need. Because caregivers are affected, just like you, from your experience. And I've had several men come and tell me that sometimes they feel so scared for the future. And sometimes they can't believe they almost lost their partner. And sometimes the safety and the intimacy of intercourse is the only thing that quiets that fear. So sex is complicated. And it becomes even more complicated after cancer. All right? But get some help with this. All right, so this is a study that Jennifer Goss did about sexual dysfunction and the female breast. She termed a phrase that I want you to sort of recognize: breast-specific sensuality. All right, it just says the breasts are important to women. It's a major reason for stimulation, for arousal, and it's lost. You could have had a lumpectomy, you could have had a mastectomy, but it's lost. The treated breast in a large proportion of patients is no longer a part of sexual health. All right? I don't even think partners understand that. They might see you as beautiful and your reconstructed breasts are beautiful. And this used to be the thing that brought you joy. But it doesn't feel anything. That's a very hard conversation to have. We recognize that. But I want you to understand that's also a true phenomenon now. There are things that can be done to help you rediscover sexual health, things that treat genitourinary symptoms of menopause or GSM, vaginal dryness. We can use multiple things that are evidence-based. If you have painful intercourse, we can prescribe in very specific circumstances lidocaine. Okay? There are things that can be done for painful intercourse related to thrust, including dilators. There's not a lot that we can use for arousal, orgasm, or desire. But I can tell you that much like it's a circle, these are not things that happen by themselves. So sometimes you fix one domino that refuses to fall, and the other ones will fall as well. For women with gynecologic cancer, even though it's not an organ that men see, right? We can't see your uterus and your ovaries and your cervix. It is still something that women mourn, and we recognize that too. So this is just some of the ways that women will process having gynecologic cancer. It's a before and after phenomenon. My body before cancer, my body after cancer. And it's really trying to embrace what that body looks like now. That is such the hard part. And this is, I think, where intimacy comes in. No matter what the situation is, if you are a part of a couple, then recognize that intimacy is a huge key to recovery. It can help you in terms of dealing with your stressors. If you have that, it can also help the both of you recover a new normal. So there's this group of two investigators, Mann and Barter, who showed even in situations where men cannot have intercourse or where women are unable to, a couple can come together and adjust and find other ways to express themselves. That is highly satisfying. In fact, in their study, they criticized oncologists and physicians because we were the ones who prioritized a specific form of sexual activity. And our couples were telling us, yeah, that's not it. Okay? I believe that there's data now that says couple-based interventions after cancer absolutely matter. It's a very limited data set, absolutely. But at Brown, we're starting a couple of studies looking at couples after cancer and seeing if the introduction of intimacy exercises early can help couples adjust later. This is sensate focusing is one of the things we're looking at. And it's teaching intimacy through play, and it goes through these 4 stages. And I actually spend the time to talk to couples about this. Stage 1, literally, you're sitting in a very quiet place, no distractions, clothed to your comfort level, and you take turns touching each other. Okay? My last couple I talked this to said, we tried, we felt stupid, I just couldn't. You know? This is like, so I understand that, right? But on the flip side, the whole thing is stupid now, right? Your life doesn't make sense. I don't understand. The whole thing's stupid. You got to start somewhere. And if you're a part of a couple, I want you to try. The goal is not to get to stage 4 where all the clothes are off and you can touch everything and do whatever you want. The goal is to just reconnect. Okay? So this is available. There's also some online tools now. This is my friend Leslie Shover, who was at MD Anderson prior, has done this huge online intervention called Will to Love. And essentially, you sign up, you set your goals, she points you to some material in a very directed way, and it's a way for you to really and truly dedicate yourself and your partner to an online program, right? will2love.com. So what about fertility? should be addressed prior to treatment. We all know that. It's on us to make sure that we've discussed it with you, all right? But recognize as well, there are women who went through treatment because there was pressure that they needed to get this thing treated. And then after the fact, they're wondering now, will I ever become a mother? Will I ever be able to parent? Will I be able to breastfeed? For my patients who were diagnosed early with cervical cancer or uterine cancer, it's even more devastating because they will never carry their own child. So for women who were able, though, to get pregnant after cancer, there are still some folks in medical communities who are uncomfortable with pregnancy after cancer. That is false. You can carry, and if you're able to get pregnant and you want that child, you should carry that child. There is something called the healthy mother effect after breast cancer. If your body went through chemo and radiation and surgery and you still got pregnant, your biology is strong enough to withstand everything. In fact, if you're able to carry that child to term, your prognosis after breast cancer is better. Isn't that interesting? It's called the healthy mother effect. Pregnancy is associated with a 40% reduction in the risk of death. All right? Now, I'm not saying all of you get pregnant now. I'm just saying this is what we know. All right? Your child is not going to be malformed because you got chemotherapy in the past. Okay? So there should be no worry about that. There is one singular exception which is very relevant for women with breast cancer, and that's trastuzumab. If you got trastuzumab in the adjuvant setting or a year's worth, you should abstain from or trying to get pregnant for at least 7 months, if not longer, because you are going to be at risk for some complications in the baby. So the typical recommendations for women who got chemotherapy is to wait 2 years. That's based on consensus, not on anything hard evidence-wise. But what I will say is that if you find yourself pregnant after breast cancer, and the reason you might get pregnant is if you're on tamoxifen, because that used to be used to help women get pregnant, okay? And you want that child, do not ever let anyone tell you you need to get an abortion. And I still see women sometimes who've gotten that advice. And that is not advice you should follow if you want that child. But for women who find themselves unable to get pregnant, parenthood is still possible. Okay? You could explore adoption. There's nothing out there that specifically protects cancer survivors from bias, although the Adults with Disabilities Act should protect you from that bias. There's also surrogacy as an option where, depending on the scenario, you get an egg donor and you ask someone else to carry that baby for you, okay? I know about surrogacy because it's how I had my kids, okay? So my message here is that if you always saw yourself as a mother or a father, all right, you should explore that. Breastfeeding after cancer, for women with breast cancer, you should not use the radiated breast, but you can use the non-irradiated breast. For folks like us who do what we do in SurviveAL and elsewhere, we want to make sure you are reflected in those brochures about breastfeeding. All right. So this is a comment someone sent to me. You know, it would sure have been nice if there was a picture of a woman who had a mastectomy breastfeeding from her quote good breast. Why aren't those pictures there? You know, this is why survivorship needs to exist as a term. Healthy lifestyles, again, recognize two things. Heart disease is the #1 killer in women. And the nurses' health studies show that if you walk at least 9 hours a week, we can reduce your risk of any bad outcomes, heart disease, angina, by at least half. So in the picture on the right, it's what healthy lifestyles entails. So it's about modulating food intake and what you take in, and it's about increasing the energy you expend on a daily basis. Both of them, okay? This is a Success C study that was in breast cancer, just presented at San Antonio. Very complicated slide. They had this in the red box. Women were randomized to a lifestyle intervention or not. And this was the lifestyle intervention that was seen. It was a telephone and mail-based program, as well as motivational interventions. This shows that with the lifestyle intervention arm, women lost weight rather than not in the non-intervention arm. Surprisingly, there was no difference in survival with the lifestyle intervention. So the investigators are smart. They looked back and said, did it matter if you were adherent, if you completed the program? Did that matter at all? And what you're seeing is on the right side, if you completed the intervention arm, you lost your weight, okay? But if you didn't complete the intervention, you did as well as the control group, all right? So maintenance and really being able to adhere to that program was where the weight loss happened, and it's also where they saw the survival benefit. Okay, very provocative results for us. So again, the summary right now, overall the trial was negative. But we shouldn't walk away saying, doesn't matter, go to Burger King, sit on the couch, it doesn't matter. That's not true. There's going to be some really important issues bringing up. The question now is, how do we design a program that women want to do? All right, because I think this is the message. And in terms of financial health, we all know that treatment for cancer puts everybody at risk for bankruptcy. Right? It's very expensive. We know, though, and this is really alarming to me, if you were at risk for financial burden at the point of diagnosis, you had lower quality of life. You were more anxious. Your life wasn't what it should be. But if by what I do, you are now at risk of a financial burden, not only is your quality of life worse, you're at higher risk of dying. This is alarming. Financial toxicity can put you at risk of death from cancer. So we need to work with you to react to those costs, but we also need to convince you to also protect you from those costs. So these are some of the things that I've seen. Learning the language of your insurance is hugely important. Getting in touch with the hospital's business office early is important. Learning about your options at work, your protection is important. Accessing social work, keeping a record of your expenses, and then asking your doctor if they know what the Choosing Wisely campaigns are. And so these are things that our medical societies are doing to prevent us from spending as if it doesn't matter. So what does that mean? I think you need a CAT scan every 3 months. That is absolutely not a wise choice, all right? So you can ask your doctor, is there a reason why you exactly want me to go through a CAT scan every 3 months? All right. This is about PET scans and why your PET scans may or may not be covered. Not only should you ask, is it covered? You should be asking, do I need it? Okay. So moving forward, this is a quote that I like. The world is empty if one thinks only of mountains, rivers, and cities. But to know someone who thinks and feels with us, who, though distant, is close to us in spirit, makes the earth an inhabited garden. The point is that you are not alone. You shouldn't go through this disease alone. It is a disease. It's not a state of mind. It will never define you. And people are going through it just like you. So cancer does mean we have to get educated. No one wakes up one day and says, I think I'm going to get cancer today. I'm going to learn everything I can about it, right? That's not how this works. You can get educated through engagement, just like you're doing today. And only through those two steps, I do think you evolve into a patient who also is a consumer, who also is going to advocate for herself and for her own community. So this is too small, but this is essentially just stating on Twitter what folks were saying about the educated and engaged cancer survivor. Because when all things are said and done, we can make things better. We should make things better. But I'm not going to do it for you. We need to do it together. Okay? We are our own heroes. Thank you so much for having me. Just a big plug. Follow me on Twitter and Instagram.